it's Sierra and I'm back with another video. I think I kind of like y'all right here better than where I originally had y'all at. God damn, we about to be up on the sidewalk if I don't stop worrying about what I look like and worry about this camera about to fall and worry about this road. So as y'all can tell by the title of this video, your girl is getting her boobies done finally. Those of y'all who watched my BBL post-op video that I posted a few months ago, y'all would know that I did say a little something about me getting a breast augmentation. However, I didn't know how soon I was gonna get it, but I knew that it was coming because it's something that I personally just wanted to have done for a really long time. So I will be going to Younger Image. They are based out of Vienna, Virginia. However, they do have a DC location and they do have a Woodbridge location for those of you in the DMV area who are looking to get a breast augmentation. They also do other things as well. What else was I saying? So on August 23rd, oh, and I'm sorry, my doctor's name is Dr.Yousefi. And don't ask me how to spell that shit. And I was looking for it on this piece of paper and I don't see it. And before I run into the back of somebody, we just gonna keep it at Dr.Yousefi, and I will let y'all know any further information on him later on. Anyways, so on August 23rd, a friend of mine and myself, we decided to go down to Vienna, Virginia to have a breast augmentation consultation. So we were there. It was a really nice place. We were there for probably about an hour, just going over a couple things, sizing, questions, things like that. And they quoted me a price of $7,600 for a breast augmentation. That's the total price, including anesthesia and everything else. So they were also running a special that if you paid in full in the month of August, that you will receive 10% off. So I did. I paid in full in the month of August, and I ended up paying $6,840 total for my breast. So I'm gonna be riding around with a little Honda Accord on my chest, y'all. A little Toyota Camry or something. But anyways, so today is September 13th. Today is my pre-op appointment, and they called me yesterday and told me that I can get my breast done on Monday if I would like. Originally it was supposed to be this coming Wednesday, which I believe is the 18th, but now it's going to be on the 16th, and I am super excited. Monday works out so much better for me because I am off on Tuesdays and Wednesdays, and I'll be going Monday afternoon, so I can leave work a couple hours early, go home, get myself in order, and I can go ahead to my surgery and I can rest 2 days and don't have to worry about calling out and using my points, which is great. Right now I am on my break at work. I get a 45-minute break, and hopefully I am not late. I have to be back in 10 minutes. And fortunately for me, I am about 5 minutes away. If this bitch will move. Alright, so yeah, at 1:45, not at 1:45, yes, at 1:45, today is my pre-op. So when I get off work at 12:30, I will be going down to Vienna so I can get done all these things that need to get done. One thing that does concern me about Younger Image is they don't do blood tests. They don't do blood tests, so that means they aren't testing for HIV, they aren't testing for hepatitis, they aren't testing pretty much for anything at all. They just like, oh, you're young, you're healthy, we're just gonna go with it. So of course you're supposed to teach. Damn, why can't I talk? I don't know if it's because I'm in a rush and I'm focusing on multiple things or what, but of course you're supposed to treat everybody as if they're infected. But I would think that that would be something that the doctor would want to know. I don't have any of those things, but I personally just thought that before surgery they would at least want to run some tests on you and, you know, things like that. It's one thing for me to say I'm in good health because I feel good, but you just never know what could possibly come up. I mean, I could be pregnant right now and not even know it, and we're about to, you know, sedate me. So I don't know. I just thought that that would be something that you would want to know. However, we will be going this Monday to get this procedure done. Where are my edible arrangements? So yeah, what else is I gonna say? So I'm definitely going to take y'all with me on my pre-op journey. I am going to receive information on what it is that I need to purchase and things like that. I asked them over the phone. They told me nothing. However, I did decide to go and buy me some sports bras from Walmart, the ones that zip in the front right here, just based off of other things that I've heard from other people as far as their nipples being very sensitive. And my doctor recommended that I don't wear a shirt for, I believe he said, at least a month. They just want me to wear the band that goes around your chest to kind of push the implants down. But they was like, don't wear no bra. I said no shirt. Yeah, don't wear no bra, not a shirt. I'm sorry. That's not good. But yeah, I already know, you know, when you're about to come on and your nipples are super sensitive and rubbing up against your shirt and things kind of not makes them hurt, but they just, it's a very uncomfortable feeling. So that's what I can imagine that this is going to be like. I've also watched some people's videos where they said that it felt like needles were poking them in their nipples. So anyways, I personally bought me some sports bras just so I could have something on me and not have nothing at all. Also, I know I need to get me some pineapple juice for the swelling. And I'm not sure what else. I know I'm going to get my pain medication today. I don't know who this is. Let's call Pebbles. I wanted Pebbles to come to the pre-op with me, but I don't think she's coming. But yeah, so that's just that. I am very, very excited about that. And Pebbles finally picked up the phone. Hello.
Hey, girl.
What you doing?
I just got out the shower from washing this pussy.
Oh, go ahead and tell YouTube all about how you was washing your pussy.
So what I do is I get the washcloth and I put...
You a dumb bitch.
Girl, I don't even know. I'm supposed to go get me an outfit so I can wear it out Philly, and I didn't go get shit.
When you leave for Philly?
I'm about to ride down to his firehouse right now and leave my car in, and then I'm probably gonna go to his house.
I get my revenge when I drop on my pictures. I'm pretty like art, bitch. I look like a fixture. I get my revenge when I fuck on your nigga. I take that shit back. I won't fuck on your nigga. I fuck on his face, right in your place. Run with his money, I'm going to chase. Yo, baby daddy be stalking my page. Yo, baby mama saw minimum wage. Keep that little bitch from the fuck out my face. Gotta beat the bitch up with a fucking briefcase. Full of them beans, full of them ends.
Y'all, let me tell y'all how sis went in on that jump. She definitely went in. So, y'all, I'm officially off.
Exit 49B at 66.
All right,
Then stay to the left.
Wazy, we hear you, bitch. We fucking hear you. Fucking the YouTube video up. Let's cut her little dumb ass down. Alright, so excuse the shaking. I'm trying to talk a little louder because I know this Jeep and these big ass wheels can be very loud while I'm in the car and driving. We are officially 9 minutes away from our pre-op appointment. It is at 1:45. It is 1:03, and we will be there by 1:13, it says. So, yeah. Alright, so ignore what I'm featuring. However, we have officially made it to Dr.Yousefi's office. It is right here. This is what it looks like. My hair looks so nappy. It makes no sense at all because I just got it done. But this is what happens, ladies, when you don't wear a scarf. So I have to use the bathroom. My appointment is 20 minutes from now, but I'm going to go ahead. Is my thing not closed? Oh, it is. But I'm gonna go ahead and I'm gonna use the bathroom, and I'm gonna see if they maybe could see me earlier so I could get ahead of traffic. This is the door. You walk up the ramp here. Show y'all what the inside looks like. Hello. It's cute. All right. So I'm just sitting here waiting to go back, discuss all of our information. We have our follow-up appointments scheduled, and they want to see me the day after. gonna come at 12:45. I have 2 nails to do that day. So my first one's at 2:30. So hopefully I won't be too sore and I'll be able to do nails. Hopefully. I have no choice but to make it work. I should have saw me when I got my BBL done. I was standing up doing nails. And at the time it was taking me 2 hours to do nails. So every client that I had, I was standing up for 2 hours. Because I could not sit down. I was leaning over, y'all. My back was hurting so bad. Oh, she's ready. Alright, I'm gonna cut y'all back on. This is my paperwork, my receipt, everything.
Okay. So, here's the fun part.
Oh gosh.
We'll start reading and filling everything out. Every page has an action. Usually it's more than one thing, like a signature and initials. So if you'll just go through it, anything you have questions about, please highlight it.
Alright.
When you're completely done, open the door so I know you're all set and also the nurse.
Alright, perfect. Just open the door. I don't have to say nothing. Alright, perfect. Alright, so right now we're about to go over the surgery consent form. As you all just heard, it's kind of thick. I have to sit here and sign our life away. Am I the only one who doesn't really read this shit? And I know that I should, but I don't. Open the door so she know that I'm ready. Hello.
Sierra?
Yes.
Hi, I'm Jasmine. I'm the surgical assistant. Pleasure meeting you. Okay, so this is your pre-op visit, which means we're going to go over the paperwork, any questions you may have related to the surgery, your recovery, things to do, things not to do, etc. So the important paperwork, that's your copy. I'm just gonna make sure that you don't have any questions so far. Perfect. And what surgery are we doing?
The breast augmentation.
What type of implant?
Silicone.
All right, perfect. All right, can I confirm that this is your signature and those are your initials?
That's me.
You're a non-smoker, which is great, makes my job a lot easier.
Does it? Because I don't smoke tobacco, I smoke weed. So what does that do?
Well, tobacco, the tricky thing is that the nicotine, that's what constricts the tiny little blood vessels which are going to supply the breast and help your healing process. Marijuana, it doesn't necessarily have the nicotine in there, but we just don't like any type of products that you inhale around the days of surgery. So 2 weeks before, 2 weeks after, we just don't want you inhaling or taking anything. After that, you're good to go.
Okay. Perfect.
I have a little bit more information in the folder for you. Let's see. So this is your pre-op shopping list. These are items that we recommend that you purchase. These 2 things, they help with bruising and swelling. The Tylenol is because 2 weeks before and 2 weeks after, you can't take anything that thins the blood, aspirin, ibuprofen, Excedrin, those kind of things. So if you have a headache, you stub your toe, you can only take Tylenol, all right? Then we also recommend the antibiotic ointment. That's Neosporin. Any kind of over-the-counter antibiotic ointment works. That's because moist wounds will heal fastest. We don't want you scabbing in the area. The sutures that we place are absorbable, but regardless, you're still going to have some form of scabbing there. So this really helps with that. And then a little 4x4 gauze. That's so that you don't stain the bra when you put on the antibiotic ointment. We also have some patients that have either hyper or hyposensitivity after breast augmentations. The hypo just means basically that your nipple sensation, areola sensation will be decreased. That's absolutely fine. It eventually comes back. What happens is once we actually place the implant, the little nerve supplying that area, they get stretched and kind of confused for a little while, and then they take a while to get back into the swing of things. Now with hypersensitivity, that means anything that rubs in the area of the nipples and the areola is going to be very, very sensitive. So these are going to be your best friends because they're going to create a nice little protective barrier over that bra, so that way it's not rubbing all the time. Remember, no eating or drinking anything after midnight, not even a sip of water. Remember, no lotions, moisturizers, or anything on the skin. Bring something very loose that it's very, very easy to pop on and off because you're going to be very, very sleepy when you wake up. And so it's going to be a lot easier for you to move around that way. Comfy shoes, some flip-flops, something like that. That's easy to also slide your feet into. So, any questions from that?
I do have some questions. What about my nipple rings?
Can you put
Plastic?
retainers? Yeah. Yeah. As long as it's not metallic, it's fine. Our issue is when it's metallic. We use a Bovie or electrocautery device, and so what that uses, it uses a current to stop any kind of bleeders. So if you have any metal on your skin, you can run the risk of having burns on the skin.
Okay, so I also have dermals in my back that don't come out.
We'll just put a little tape around them.
Okay.
And we'll try to monitor those areas to make sure nothing's happening there as well.
Okay. All right. That's
Yeah.
all.
So we also have the breast implants here. So you can also play around with them. You can put them inside the bra and see how it looks in your shirt. And that's pretty much it. So we're gonna take photos, do the measurements, and you can play with bras. I'll print this out. So you are going to change into this little gown. You can keep your pants on. Obviously, take the bra off. The gown will open up towards the front, and we'll continue. All right.
All right. All right, y'all. So let's get about these clothes, these footwork clothes, and get into this gown. This is what I'm featuring outside of my uniform. You get the uniform. We about to get some settings. Alright. Let me catch y'all. So as y'all can see, y'all, I have no boobs. No boobs at all. And you can also see that, let me sit up straight. That this one is slightly lower and like just off to the side than this one, so scoot up. I'll fix it.
Hello.
Hello, fine. How are you? Good to see you
So
again.
you're excited?
I am excited. Just ready to get it over with.
Not nervous yet?
No, I'm not nervous.
All right. Okay, so let's go ahead and measure you.
Alright.
So I heard that you don't want to be too big, right?
I mean, I don't want them to be like huge, but I want them to be big. I want you to notice them.
To
But
see
you know,
the
I'm not
difference.
but so big, so I don't want boobs that are gonna be.
Natural, so.
Yeah. Well, I'm not gonna say natural because I feel like if I say natural, you're just gonna like give me what I got, but just like fuller. So no, not natural. Unnatural. Just not huge.
I know. Okay, so let's see what the biggest we can give you.
Okay.
So yeah, go ahead and have a seat right there. Huge. Well, actually, they don't come for $75.
You know?
It's either we're doing silicone, right?
So 450 or 500.
So it's either $450 or $500. You see, it's interesting. Everything else is 25, 25, 25, 30. You see 350, 375, 400. Then all of a sudden, after 400, it gets 450, 500. Because it's not a big difference, 25. So I think they want to save money. You can custom made it, but it's very expensive. So either, I would say go 450.
450?
Because you see, the bigger the implant, more complications in the future. Sooner, saggier, it's going to be heavier. And also the incision has to be bigger to put it in.
The bigger
The bigger the implant,
yeah.
because these are filled. It's not like saline, you can fold it and put it in. So it's a bigger incision, so you have to consider all of that. And when you have to get really a stretch, you can see the rippling later on, all that stuff. So
Okay, well 450 sounds
I think 450 is pretty big anyway. All right, so we'll do that.
Perfect.
Sounds good.
Sounds
Thank
good.
you.
So on the day of surgery, we're going to see each other again. I'm going to mark you and show you where the cut is going to be, how long it will be. Okay, there you go.
All right, thank you. See you
You're
on
welcome.
Monday. All right, y'all. So I'm back. I'm leaving Dr. Yousefi's office. I'm about to get ahead of all of this traffic that I already know I'm about to be in. I'm a little hungry, but I know we have some fried chicken in the house, so I'm just gonna eat that. We are going to stop at the gas station. No, maybe not. Maybe not. I don't know. Yeah, the gas light is on. We probably should stop. Maybe we could get in front of this car right here. Oh, how sweet of them to let me through, even though me and Bella was coming through this motherfucker anyway. Ew. Alright, y'all, so I'm pressed. I got that out the way. Like I said, surgery is in 3 days officially. I talked with my manager. They're gonna let me off 1 to 2 hours early on my surgery day so I could go home, kind of freshen up, things like that, and then hurry up and get across this bridge. So I'm excited about that. Alright, y'all, so stay tuned. We will be back.